Welcome to our channel Medico's Learning Decks. Here we will discuss easy mnemonics, high yield topics and integrated revision of topics related to medicine. So let's start.
So today's topic is anesthesia circuits. Mainly we will focus upon the Mapelson circuits. So we will see some mnemonics to memorize the Mapelson circuits very easily. Okay, so let's start. So first I'll give a brief introduction about the anesthesia circuits, then specifically we will see about the Mapelson circuits and its mnemonics. Okay, so first, anesthesia gas exits the anesthesia machine. See, the anesthesia gas will exits the anesthesia machine and then enter a breathing circuit. So these breathing circuits will be divided into different types. Mapelson circuit is one of the breathing circuits. Okay, in the anesthesia machine or anesthesia circuits, they are the breathing circuits. So what's the function of the circuits? To deliver oxygen and the anesthetic gases also, to deliver oxygen to the patient and also anesthetic gas, and also the patient's respiratory CO2 which is exhaled, that will be eliminated by the breathing circuit. So it has two functions. Okay, first to deliver the oxygen from anesthesia machine, O2 delivery, and CO2 removal. Okay, CO2 removal. It may be classified into open, semi-open, semi-closed and closed. Okay, so these are the divisions: open, semi-open, semi-closed and closed. So let's see. Now coming to open systems. Okay, open systems or open method can be are examples of, like, see, fresh gas flow or reservoir bag or APL valve. And also another method was that old fashioned method where a drop of chloroform will be poured over a gauge or just a cloth paste. See, this was the open method. So the primitive method was the open method of breathing system. Here also you can see this Schimmelberg's marks, which is also a open circuit, that is open breathing system. See the photo again. This is the Schimmelberg marks. Okay, semi-open systems. Okay, semi-open systems are the breathing systems which utilize room air and will have a self-inflating resuscitative system. Let's see the semi-closed system. So this is our main area of interest. Okay, semi-closed system. Under this it will fall the Mapelson systems. So the Mapelson circuits are semi-closed circuits. These breathing systems will have a bidirectional flow of oxygen and also exhaled CO2. Okay, and there will be no CO2 carbon dioxide absorption system, because this is a semi-closed system, so we do not need any carbon dioxide absorption material. Okay, so now see another classification, that is the closed system. Okay, under this closed systems, first we will see the difference between the closed circuits and the semi-closed, that is the Mapelson circuits. Okay, in semi-closed, enclosed it will be a different two limbs will be there, that is inspiratory and expiratory limb will be different. Okay, and here the valve will be also unidirectional, so the flow of gases and oxygen will only be in one direction, not in either direction. And here CO2 absorber is also needed, because it is a closed circuit, that's why we require a CO2 absorber. Okay, whereas in semi-closed we didn't have any CO2 absorption facility. Okay, see, here it is a arrangement of closed circuit. So here will be the patient and here is the fresh gas inlet. Okay,
See, I'll mark with different color. Fresh gas inlet. Okay. Now this is the soda lime canister, that is the CO2 absorber. And here see the valves are there. These valves will be one-way valve, so as to facilitate the entry of gas only in one direction. See here, fresh gas, that is O2 and other anesthetic gas, will enter. It will go through this direction to the patient, and the CO2 exhale from the patient will go in this direction. Okay, so here is the expiratory valve. It will go, and some part which is remaining will be absorbed by the CO2 absorber. Okay, so the direction of flow will be unidirectional. The valve will also be unidirectional valve, and expiratory limb and inspiratory limb are separated. See, this is the inspiratory limb and this is the expiratory limb. Okay, let's see once again. See, here is my patient side. Here is the fresh gas inflow. So this will be my inspiratory limb. Okay, and when the patient exhales the CO2, and it will go to the CO2 absorber, so this will be my expiratory limb. Okay, and see here, valve will also allow only unidirectional flow. Valve will allow only unidirectional flow of gases. Okay, here is the same thing is given. Here the patient end, and here the fresh gas. So this will be my inspiratory. Okay, this will be my inspiratory limb, and from the patient to the CO2 absorber will be my expiratory limb. Okay, now we will see in details the Mapelson circuits, and also very good mnemonics to memorize this, because this will be important in every exam, like NEET, PG, Next, AIMS, FMG. Every exam, 1 or 2 questions you will get from this Mapelson circuit. So let's see. Mapelson circuits are breathing system, that is semi-closed system. Okay, it falls under which category? Semi-closed. We had seen open, semi-open, semi-closed and closed. So this Mapelson circuits will fall under semi-closed. So it will have bidirectional flow of gases, and there wouldn't be any CO2 absorption facility, right? So let's see. There will be a fresh gas connection. The components of the Mapelson circuits we'll see. Okay, here there will be a fresh gas inlet or fresh gas connection. Then there will be an adjustable pressure limiting valve, which is also known as the APL valve. Okay, this is important, so remember this for now. Okay, then we'll have the reservoir bag and tubing and waste gas connection. First we will see what all Mapelson circuits are present. Okay, Mapelson A, Mapelson B, okay, Mapelson B, Mapelson C, Mapelson D, E and F. Okay, now we will find a very good mnemonic to memorize, how to identify the, if any circuit is given and asked, that you will be asked to identify which Mapelson circuit is this. Okay, so let's see. First, see, we will first see which is the APL. See, we'll first see which is the adjustable pressure relief valve, that is the APL valve. We saw APL valve. We have to see the fresh gas flow, and we will see where is the patient end and where is the reservoir bag. So this 4 criteria we have to see first. Okay, APL, fresh gas flow, patient end and reservoir bag. This we will see, and by this only we can identify all the circuits. So Mapelson A, for Mapelson A, the APL, see, A for A, A for A, A for A. So APL will be on the patient sides. Okay, APL is on the, see, exhaling valve or the APL valve will be at the patient end. So by that we can remember that Mapelson A APL will be on the patient side. Now we see that this is the reservoir bag and fresh gas flow. This is the convoluted tubing. Okay, here is my patient end, and here the APL valve is there. See, this is the valve. Okay, so Mapelson A circuit, APL on patient side. Now we will see some more information about Mapelson A. That is, Mapelson A circuit is also known as the McGill circuit. It is the best circuit in the adult. Best Mapelson circuit in the adult for spontaneous ventilation. So now let's start with Mapelson B. In Mapelson B, what we will see that both APL and fresh gas flow will be on the patient side. Okay, so this was my patient side, this was my fresh gas flow, and this was my fresh gas flow, and this was my APL valve. So both the fresh gas flow and the APL valve will be on the patient side. So B for both. So Mapelson B stands for that both APL and fresh gas flow will be on the patient side. Now let's see Mapelson C. Okay, in Mapelson C there will be no corrugated tubing, that is no corrugation. C for corrugation, C for Mapelson C. So here you see, here you saw that there is a corrugation tubing. In Mapelson C there will be no corrugation. The corrugated tube is absent. So an example of Mapelson C circuit is also the AMBU bag. AMBU bag is used for resuscitation in the babies also, and in adults also we use sometimes. So that AMBU bag is an example of Mapelson C. Okay, coming to Mapelson D. Here the APL will be distant. D for distant, D for Mapelson D. So now let's find where is the APL. Here is my APL and here is my patient side. So APL is far away from the patient side. So the distant APL is for Mapelson D. Okay, this is the best circuit in adult for controlled ventilation. For spontaneous ventilation it was Mapelson A. For spontaneous ventilation we saw that is Mapelson A for adults. Okay, and for controlled ventilation it will be Mapelson D. Okay, it is Mapelson D. It is also known as the Benz circuit, or also known as the universal circuit or the coaxial circuit. Okay, Mapelson E is will have no bag and no valve. Okay, so the reservoir bag is also absent. See here, no bag is there, reservoir bag is also absent, and the valve is there, the valve is also absent. So Mapelson E has no bag and no valve. So it is IR's T piece where this kind of tubing is there, that is also known as the IR's T piece. So that is an example of Mapelson E circuit. Okay, that is an example of Mapelson E circuit. Now coming to Mapelson F. Okay, Mapelson F will have no valve. Here the reservoir bag is present, but there will be no valve. See, reservoir bag is present, but the valve here is absent. It is also known as the Jackson-Rees circuit. Okay, it is the best circuit in children for both spontaneous ventilation and also controlled ventilation. Okay, so in children For both spontaneous and control, we use the Mapelson F circuit. Mapelson F. In adults, in control ventilation, we use the Mapelson D circuit. And for the spontaneous ventilation, we'll use the Mapelson A circuit. Okay, so now we will see the circuits one by one and try to identify it. Okay, we'll try to identify it. See, first here it is the patient end, so we will find where is the APL valve. Okay, APL valve is on the patient side, so this will be Mapelson A circuit. Now here other things we see, this is the fresh gas flow and this is my reservoir bag. Okay, there we see the fresh gas flow and also the APL valve. Both are on the patient side. So this must be my Mapelson B circuit. Mapelson B for both. Okay, next coming, there is no corrugated tubing. See, there is no corrugated tubing. My APL valve is on the patient side, fresh gas flow is also the patient side, but corrugated tube is absent. So this is the Mapelson C. C for no corrugation. Okay, now coming to D. Okay, D was for distant APL. See, this is my patient side and the valve, APL valve, is distant from the patient side. It's not in the patient side, it is distant from it. So for distant APL, it is Mapelson D circuit. Okay, and Ayers T tube, what I said, that is E. It is an example of Mapelson E circuit where there is no bag, no APL valve, there is no reservoir bag and there is no APL valve. Only here we can see that there is fresh gas flow. Here is my patient side. Okay, here is my patient side, and there may be any reservoir tube, but reservoir bag is absent. Okay, so no reservoir bag, no APL valve. That is my E. It is an example for Ayers T piece is an example of Mapelson E circuit. Okay, now coming to Jackson-Reeves modification of, or also known as Mapelson F circuit. So here only the APL valve is absent. See, here the bag is present, fresh gas flow is present, this is my patient end, and corrugated tube is also present. Only APL valve is absent. So this is my Mapelson F circuit. Okay, now let's see coaxial systems or coaxial modification of Mapelson circuits. Okay, there are only 2 to 3 coaxial modifications. See, for Mapelson A, there is a coaxial modification which is also known as lax modification. Just remember the name of the coaxial circuit and it is a modification of which circuit. That's more than enough. Okay, that will be more than enough. What do you need to see in coaxial circuit is that, see, here the corrugated tubing is present and inside it also a tube will go. So therefore it is known as a coaxial circuit, that is 2 circuits existing in between. Okay, here the corrugated tube is also there and another tubing also will go. So lax modification is a coaxial modification of Mapelson A. Okay, Mapelson A. See, the coaxial is meaning is tube within tube. See, there is tube and another tube will be there. So tube within tube is all known as coaxial, that is dual arrangement or parallel arrangement. Now for Mapelson D, we have a modification known as Benz modification. Coaxial modification is of Mapelson D. See, just remember the name. That is Benz modification, of which Mapelson circuit is it a modification, that is Mapelson D. Lax is for A and Benz is for D. Okay. McGill circuit is also a modified coaxial circuit of A, and Lax circuit is also a modification of Mapelson A, and Benz circuit is for Mapelson D. Okay, so just remember these names. This is more than enough. Okay, you don't need to go into the details of this coaxial modifications, but just remember the name. Okay, now here is a mnemonic to remember the efficiency of Mapelson circuits. Okay, this is also a commonly asked question, so I kept it here. That is, efficiency of Mapelson circuits will be asked. So for one we have for spontaneous ventilation and one we have for controlled ventilation. Okay, for spontaneous ventilation it is remember the mnemonic, that is a dog can bite. Okay, a dog can bite anyone, so it is a spontaneous event. Okay, so for spontaneous ventilation the mnemonic is a dog can bite. So A, D, C, B, and E and F will come with this. Okay, E and F will come with this. A for a dog can bite. Okay, so a dog can bite is for spontaneous ventilation. Okay, and for controlled ventilation, dead babies can't assist. Okay, dead babies can't assist. So D for dead babies can't assist. So D, F, E is also again clubbed together here also. So dead babies can't assist is for controlled ventilation. Okay, so this was it. I hope you can remember the Mapelson circuits and identify them very clearly now. Okay, they will give some diagrams and they will ask you to identify which Mapelson circuit is that. So now I hope you wouldn't forget how to identify.
Thank you for watching. I hope you found this video helpful. Do like, share and subscribe to this channel to get more videos of this kind.